Alright everyone, so I'm going to do a Medicare Center training again. This is going to be using the Medicare app and actually going through the entire preferences section. So go ahead and take some notes, get out a pad, pencil, pen, paper, what have you, and I'm going to take a little bit longer deep dive into this one. Get some coffee if you need, I got mine. So we're going to go into Medicare app here. And we're going to start by kind of going through what you would have to do whenever you make a new client. So you'd have to go through new profile, and you're going to want to fill in all this information here. Okay, as much as you can. The only thing you really need that's set so by the system is actually these three. So the zip code, we're going to keep it simple, use that same one, and we're just going to call this one test. That way we can have some kind of a reference. And then let's go date of birth. Let's make this person about 70. So there we go. Now we can continue to plans. This will take us directly to the quoting area software or quoting area page. We got those tabs and the different Medicare plans. And SOA will allow us to fill out a scope of appointment form for this client. We can simply save it, look it up later. We can add preferences just so that we can get more out of this training. I'm going to go ahead and save, and then I'm going to go back to my dashboard. And because we created that, client, so we're going to go to search. We're going to type in test and search profiles. And there we go. Our test that we updated here. As you can see, I've done this many times before. Our test one that we uploaded today is this one. So let's go ahead and select it. It'll go back to that beneficiary information page. Right, and let's go to the add preferences because that's what we're going to work on in this video. So when it comes to add preferences, we can choose first what kind of plan they want. For the sake of this video, we're going to have the most complicated one, the Medicare or medical and prescription. All right, in the health portion, we already know that this person is 70. So now we have to figure out how healthy they are. Now they give us some guidelines to go about here. Generally healthy means they have no major illness, less than 2 prescription medications, and less than 2 visits per year to the primary care doctor. Some health needs is you have ongoing conditions like diabetes or that have regular prescription needs, and 1 or more visits to a specialist. That's every year. Significant health needs is you have multiple prescriptions, multiple serious conditions, and multiple visits to specialists. Most of my clients fall in this area here. So let's go ahead and leave it where it is. You may have to move yours from generally healthy, but for the most part, this is where I usually run the analysis. Continue. Now the fun part, providers. Make sure you have all of your doctors from your clients, their location as well, because sometimes the location can kind of screw around with the provider networks here. So what I'm going to do is I'm going to type in a doctor, and it's going to find all the doctors with the same name, all of them, no matter what they do here. So this is why it's important to not only have their first and last name, but also their location. Because if you can see, there's so many Peter K. Lees. It might not even be the network. But let's go ahead and add the Kwokini location. Let's go ahead and set him as the primary care doctor. Next, let's go find another doctor who is probably in the network. Go ahead and find cardiologist. See what I mean? It's very difficult to keep finding or to look, especially if they don't, they only allow you to search by provider name here. Well, maybe this provider is not the right name. Huh. Looks like it. Hang on, let me check first. Yeah, for whatever reason, it can't find Dr. Rivera. Maybe it's... There she is. Had to expand the range, and I believe it only allows you to search within like a small area, so make sure you change to the zip code as well. Something I didn't mention, but you will have to do that. Now prescriptions, so she has a cardiologist, so let's say they're on carvedilol. And the default or the automatic listing here of the amount and the quantity seems to be like the most common dosage, but you can change it, but we'll just go with the most common because it's easiest. Losartan. Metformin. Stuff my clients normally have. Let's go with a statin. There we go. All right, it's about good. 4. Now we find the pharmacies. So we can go ahead and find the pharmacy. I like to add Walgreens. For myself and my Hawaii clients, I like to add in a Longs because everyone usually knows Longs, and a Safeway. I do this because it gives us a good variety of the different locations that people can probably would expect to go. And if they do have their own, of course you make that one of the pharmacy that you put in there. Continue. Now many people like dental. I'm going to just put dental on there just for fun. Now we continue, and when we continue we're going to get back to that page where it shows all the plans, but this time it's actually going to show us all of their doctors and the medications. I like to sort it total estimated cost instead of the actual preference score high to low, because I don't really know how that was calculated. This one is calculated based on dollars amount, which I can easily see. And as you can see here, Peter K. Lee is not in the network for United or Humana. Well, that's going to be difficult. Let's go find a... So if this happens, you can always edit this list. So the provider list, you can edit it, and you can edit it down here. So go to providers, go to edit, and it'll take you back to the provider page. So now that we've done that, let's go ahead and try to look for a provider, primary care doctor here. And the best way to do that is actually out here, the MDX Hawaii. Provider search. Let's go ahead and find right now. It's going to pull up all the providers who are nearby this area. Oh, I pulled up all the specialty. Hang on. Let's go to general practice. Search. It actually pulled up all the mail providers. Here we go. This is better. So accepting new patients. These are the locations. Accepting new patients. Accepting new patients. So general practice, quite a few. Actually just a few. Internal medicine. Let's see if we have more luck there. We have only 3 in this one. Looks like the bar's a little bit bigger. So yeah, internal medicine, we have a lot more established patients. So here we go. Christopher Dubik is accepting new patients. Paul Kim, Dr. Kim, Keiichi Kobayashi, Carlos Lam, all of is established, but he is accepting new for United Healthcare. So these are the different ones you can choose. Accepting new, some of them accepting new for one side and not accepting for the other. Make sure you check this out. So it's for fun. We will say that since we're looking at Humana, Leong. So let's go find Leong here. Albert. And let's take off Peter. And now set Albert. There we go. Continue. And what I usually do after I press continue to make sure it's saved, I just go to plans. Because we already had filled in all this information prior. Let's see if the plans are now refreshed with the doctors in network. Alright. So we're going to just click off HMO. So I just want PPOs. And I only want Humana and United because it looks like WellCare doesn't have my cardiologist. So we're going to go with those 2. Oh. Odd that it did that. I guess the local PPO needs to be selected, not the regular PPO. Okay, so all doctors in network, all doctors in network, all medications covered, all medications covered. Okay, looks like according to the cost estimator, this plan here would save us the most money. So let's go ahead and add it to compare. Let's add the second one to compare and the Humana one as well. Okay, so we can compare all 3 of these. Let's compare it and see what we get. So the $55 per month United Healthcare Plan 2 estimated health cost is $1,048 for the partial year. For health costs, the drug cost is going to be $60 per year, or partial year anyway. And then of course we have the plan premium, which the member has to pay as well. So all in, these are the costs that are associated. Now as you go further down, you can see how the costs stack up against each other. Right, so we have a $0 copay, the $55 and the $56 plan, and a $5 copay on the 0 per month plan. We can see that the costs are the same for many things. The things that aren't highlighted, the costs are the same. Things that are highlighted means that they're different. Doctors are all in network, medications all covered. But this doesn't tell us the whole story, right? Sometimes when you do a fact find, you find that the client really likes a certain additional benefit that Humana provides, which also needs to be part of your input into them choosing a plan. But as far as objective data, side-by-side data, this is the only way you can actually show that information via something like this, where a lot of the benefits are the same throughout all, right? So we can provide this, and you can right from here send a quote to your client, right? Shows up on their phone. Just go ahead and do a test real quick. Send it to myself. And boom, came to my phone. You'll have a user authorization code, and you can create a task here as well. I'm not going to because this is just a test. Go online, and I can view my quote as a client on my phone. I just need my authorization code, which was in the text message. I can go ahead and type it in and view my code or view my quote that way. Now for your references, you can go ahead and check and see the individual plan details. So let's check out the best or the most appropriate based on costs here. We find that here are the visits all by themselves, out-of-network benefits, pharmacy benefits, how much things cost at the mail order or at the preferred pharmacy. Also, important plan documents. So we can click here and get the summary of benefits and look closer into actually what each individual benefit is. All from the Medicare app system. You can go over to prescriptions and find out how much each prescription is going to cost. Looks like all these medications are tier 1 in this plan. And if you go to Walgreens, you'll be paying $3 for each fill. If you do mail order, you won't be paying anything for any of the fills. Right. Safeway, some will be less than $3, right? Longs as well. But there's Walgreens. Quite simple, very efficient. And from here you can go ahead and start breaking down more specifically on what benefits matter. Maybe they don't want to pay $55 a month. Maybe they want to see what the zero premium plan looks like. Or maybe they would like benefits that one plan offers that another one doesn't. Maybe they want to make sure that the gym that they go to is also part of the benefit plan of the new one because that's what they enjoyed this year. Maybe they want to make sure that dental is included because they liked the dental plan that they had with their current Medicare Advantage plan. Right? We don't know till you ask. And then once we've kind of gone through their preferences, what they enjoy in their plan, can make some objective decisions on the plan moving forward. Well, this was a video on how to kind of set up your client and get them onto the Medicare app and perform an objective kind of quantitative analysis on the Medicare Advantage choices that your clients have. I hope you enjoyed the video. We'll see you guys in the next one where we talk a little bit more about prescription drugs and how to find plans or how to find solutions if your clients are taking medications that aren't covered. Right? We'll see you there.